In India, like it is very much common misconception and myth that diabetes happens to the obese people, but that's not the true. As in NFHS conducted in the as in India, there are approximately half of the diabetic patients are lean and thin, and their BMI is lesser than 25. So, having a sedentary lifestyle with the PAL or the physical activity level, that is the ratio of energy expenditure upon your BMR. So, if you are having PAL of 1.2, that is having sedentary lifestyle, then you're most likely to get diabetes if your genetics is just linked about that mutations of the diabetes mellitus type 2. So of course the genetic reasons are very much important in insulin resistance, and approximately 10% of the obese patients are diabetic. Not all the obese people are diabetic, and around 2%, 2.5% of the lean patients are diabetic. But if we look at the diabetic populations, so we find that 43.5% of the females and 52.5% of the males having diabetes are lean and having BMI lesser than 25. Means approximately half of the diabetic population is lean and thin, and their BMI is quite low, below the 25.0. So here, this is the very much remarkable thing, that you should not suppose that if you are consuming less energy or you are having a higher BMR, then you are being safe. Even if you are a lean and thin patient, lean and thin, and you are not very much physically active, means if you are not expending more than 6 to 700 kilocalorie per day in addition to your BMR, then lots of the free fatty acids and the glucose can be converted into the triglycerides and fat into your viscera and in your adipose tissue. And in the India, the situation is quite grim, because if a person with a normal BMI, they are having a larger proportion of the fat in their organs and in their tissues. So in the Indian males, there is very most likely that the fat will accumulate